Hi there, everybody. It's Dr. Josephine Braid here. I'm in Toronto at the moment, attending the World Congress on Brain Injury, and I really wanted to share with you the importance of knowing about concussion in women and girls, so really concussion in females. Yesterday we had a great talk from Catherine Sneedaker, who's the founder and executive director of Pink Concussions, which is really a non-profit organisation about the voice of female brain injury. So I just want to spend a few minutes today to share with you some facts about concussion in females, what this can result in, what the main causes are, and what to look out for if it happens to somebody in your family or somebody close to you. So really, females sustain more concussions at a higher rate than their male counterparts, yet we think that males might sustain more because they take more risk-taking behaviour. Women report a higher number and more severe symptoms than males, and they have a longer recovery period than males do after concussion. If a woman's recovery spans more than a few weeks, she's more likely to have depression, isolation, self-doubt, and anxiety. So what is a concussion? It's a brain injury with a brief or no loss of consciousness. So it's not trivial. It is an injury to the brain. It is an injury to the brain, and it must really be taken seriously and monitored for recovery. There can be a lot of different symptoms at play after a concussion, and these can range from headaches, mood swings, visual changes, and dizziness, amongst others. The four main causes of concussion. Sport. This is what we commonly think of when thinking of somebody at risk of a concussion, and that's where most of the funding and most of the awareness definitely is in concussion. Motor vehicle accidents. So I work with people with brain injuries from motor vehicle accidents, but generally people with concussion don't actually come to our clinic. So it's motor vehicle accidents may have other injuries, but there may also be an element of concussion that happens with the motor vehicle accident. Domestic violence or intimate partner violence is another source of concussion. People in the military are at risk of concussion from blast injuries, and also depending on what their role is, if they do lots of parachuting, they might be more at risk of concussion. And also we should think about the elderly. They are more susceptible to falls, and they might hit their head in a fall and risk concussion then. Here in Canada, in 2016, there was a law in Ontario that was passed called Rowans Law. Rowan was a female high school student who died from a condition called second impact syndrome. She was playing amateur rugby at school and suffered multiple concussions within the space of a week. And sadly, she passed away from that. Her parents have been here this weekend for the Congress. The state of Ontario passed the concussion safety legislation designed to protect amateur athletes and educate coaches about the dangers of head injuries. And this law is the first of its kind in the country. So just to give you a few statistics on concussion in females. In female basketball, 1 out of 2 collisions results in a concussion. In female soccer, 1 out of 2 headers results in concussion. 30% of concussions result from something other than sports in women, so that could be a gym class. When we look at the fallout or the effect of a concussion in a female, it can really be very far-reaching. So it can affect the whole family. It can lead to isolation, loss of employment, financial distress. And we know that women's brains are different to men's brains. They are even different to men's brains even if they've never had a brain injury. And the fluctuating hormone levels in women can significantly affect their brains. So wrapping up now, what can we do from here? I think it's really important to educate families and school students about concussion and the symptoms of post-concussion syndrome. In an earlier post, I've listed these 9 points for head bumps. These are signs of a concussion, so headache, eye trouble, abnormal behavior, dizziness, balance dysfunction, unsteady on feet, memory impaired, poor concentration, and if something's just not right, seek urgent medical assistance if any of the above occur. I think it's really important to ensure proper precautions at every age of life. So is that high chair safe? Is your kid safe on the change table? Don't leave it at all. Are your kids safe on beds? How are the car seats fitted, and are you always using seat belts? Definitely use helmets when your kids are on scooters or riding bikes, and certainly riding bikes in adults. With regards to sport, we should aim to have a healthcare professional or a coach who's trained in monitoring concussion on the side of every field or court for both boys and girls. Ensure that anyone with a concussion, particularly a female, is well supported after a concussion. You might like to check out pinkconcussions.org for more information and educational videos. And I'd be really grateful if you'd share this video if you know someone affected by concussion or brain injury. Thanks, guys. Have a great day. Bye.